O positive. It is so common that nobody expects it to have a story. Roughly 1 person in 3 has it. But then an emergency begins. This ordinary-looking blood becomes one of the bags hospitals reach for again and again. It can help most people. Yet if our mascot needs blood, most of the blood it helps cannot return the favor. So why is it everywhere? So the first clue is something that was never added. Imagine every red blood cell leaving a factory with a plain name tag called the H antigen. Type A owns a machine that adds an A badge. Type B adds a B badge. Type AB, the show-off, runs both machines. Then Type O reaches the end of the line. Its sticker machine does not work. No A badge, no B badge, just the plain tag underneath. That sounds like a factory mistake. But in a hospital, it becomes a superpower. Your immune system acts like security. Type O carries guards trained to reject A and B badges. But O red cells carry neither badge for someone else's guards to attack. The missing stickers open doors, which means O can travel farther than A or B blood. Think of every blood bag as arriving at a border. The fewer unfamiliar badges on the cell, the fewer reasons the guards have to stop it. O does not carry a magic pass. It simply gives the receiving immune system less to argue with. But before we crown O the winner, look at the plus sign. The word positive usually means the red cell carries another marker called RHD. They are 2 separate security systems. O means A and B are missing. Positive means the RHD badge is present. Most people are Rh positive, so O positive red cells can usually help O positive, A positive, B positive, and AB positive patients. 4 doors swing open. Then it gets hurt. The arrows reverse. Its guards still reject A and B. It can normally receive only O positive or O negative. It can help roughly 3 out of 4 people. But it cannot receive from roughly 3 out of 4 people. Its greatest strength belongs mostly to other people. But usefulness alone cannot explain why it became so common, especially because O usually needs 2 matching copies to appear. So how did it become the most common combination? An A or B parent can secretly carry a silent O. It travels through families like a hidden key. But when 2 hidden keys meet, the lock opens. The child tests as O. The plus sign plays by different rules. One working RHD instruction can be enough. So O can hide while positive status announces itself. Inheritance stores it. Families reveal it. Migration carries it. But an ancient killer may have decided which families survived. For that, the family tree leads to a mosquito. A malaria parasite invades a red cell, then grabs healthy cells and pulls them into a sticky cluster called a rosette. Picture one infected cell hiding behind a wall of innocent cells. A and B badges give that cluster better handholds. Type O cells lack those decorations. O is not a force field. The parasite can still infect it. But its clusters tend to be smaller, which may make severe malaria less likely. For one person, that is no guarantee. Across thousands of years, it can become enormous. Even a small survival edge could leave more O copies in the next generation. Across time, that advantage compounds, the next generation, then the next, then the next. The missing badge may have helped humans survive one of history's greatest killers. But evolution never hands out a gift without checking the receipt. The same chemistry that closes one enemy's grip can open a door for another. Related blood group sugar shapes also appear in saliva and along the gut, so microbes can use them like docking stations. And now, O's advantage turns against it. People with type O have repeatedly shown a greater chance of severe cholera. In controlled studies, Group O volunteers were about twice as likely to become severely ill. The blood type that may soften one deadly disease can worsen another. That is the strange bargain written into the cell. In one place, an empty docking space weakens a parasite's shelter. Somewhere else, a microbe exploits the same biological neighborhood. The door did not become good or bad. The visitor changed. Evolution does not build perfect armor. It patches one weak point, but another weak point may be exposed. But the next reversal comes from the blood itself. O is less eager to become sticky. That is good, until you desperately need it to stick. Your bloodstream carries a protein called von Willebrand factor. Think of it as the first strip of tape over a damaged pipe. It helps platelets grab and seal the leak. Type O tends to carry lower average levels of this tape. That may help. Non-O groups show more dangerous vein clots at the population level, which means O is less eager to build an unwanted roadblock. But when a vessel is damaged, less tape can mean less material for the first repair. That is why doctors consider blood type when interpreting unusually low levels. This does not make every O-positive person a bleeder. Blood type cannot predict one future. It reveals the trade. Less eager to block a healthy road? Less tape ready when the road cracks. O-positive now looks like a bundle of bargains. But if every advantage carries a cost, why do hospitals request it constantly? The final answer begins when an ambulance door opens. A patient arrives. Blood is needed. With the type unknown, O-negative is the famous emergency choice because it also lacks RHD. So O-positive waits in the background. Testing begins. But the result comes back. The patient is Rh-positive. So O-positive steps forward. The overlooked common bag has become exactly the bag the room needs. This happens after the first drama. O-negative buys the laboratory time. Once testing identifies a positive patient, O-positive takes over. One bag protects the first few minutes, the other helps carry the hospital through the hours that follow. Its missing A and B badges let it help positive patients across all 4 ABO groups. It becomes the workhorse while scarce. O-negative is protected. Many people have it. Even more can use it. That is the final reversal. O-positive is not valuable despite being common. It is valuable because it is common. This is why O-positive is everywhere, not because nature selected one winner, but because its rise was a relay race. Inheritance hid O copies inside families. Migration carried those copies across continents. Rh-positive status spread widely and needed only one working instruction to appear. Disease changed the course. Malaria may have rewarded O, but cholera, bleeding, and clotting pulled elsewhere. No single force created a perfect blood type. But modern medicine gave the old design a new purpose. The blank tag became a passport, and the common blood type became a hospital workhorse. What began as an absent sticker ends as a way for one stranger to keep another alive. The mascot that sent help through 4 doors had only 2 doors home. O-positive is neither super blood nor boring blood. It is built from compromises, missing stickers, one badge, hidden family copies, disease, migration, and medicine. If O-positive is your type, it cannot predict your personality or your future. But it carries a record of conflict and cooperation, parasites grabbing, guards watching, families passing hidden keys, and strangers keeping one another alive. The most common blood type was never the simplest. Don't just live in your body, subscribe, and understand it.